ROEGO TV. You see our program there. You like, you share, you comment, you ask questions, and so. And my ladies too will give you an answer on that. I will not spend my time. Let me go to them and then welcome all of them to this morning program. You are welcome.
Thank you.
And how are you doing?
We are blessed.
Maria, last week I didn't see you.
Yes, I wasn't here last week.
Are you sure?
But we are here today.
Okay, I like your earrings.
Thank you.
Wow. Okay, let's begin with our discussion. Let me start with Madam Marian and then I'll come to Madam Lillian. When we say typhoid fever, first of all, what is fever? Before we talk about typhoid fever, when we say fever, what is fever?
So I think a fever, we are just looking at an increase in body temperature. So we know what our normal body temperature is. Usually we say it should be between 36.2 to 37.2. So if your body temperature is above that, if it's above 37.2, and then you're also looking at the fact that your body is also warm. When you come to the hospital, as far as your temperature is also checked, even at home,
temperature, body temperature, heat or cold?
No, not cold. So when we are talking about fever, we are looking at a high body temperature. Let me put it that way. Even at home, our mothers, once they touch your head, they touch your neck, they're like, oh, you have a fever. That's because they realize your body is warm or your body is very hot. And normally when we take a thermometer and we check, we see that it's above the expected range. Yes, so that is a fever.
Oh, okay. Madam Lillian, can you add something to it?
Yes, she has already said it all. Body temperature is when your fever is when your body temperature exceeds the normal. You'll be feeling hot.
So what is the normal body temperature?
That's 37.
Yeah, 36.2 to 37.2 in the hospital. That's what we see.
Okay.
But I think for the layman, we say it shouldn't be above, I think, 37 or so. Yes.
Okay. All right. Okay. What do we mean by typhoid fever? When we say what is it about?
So now that we've seen what a fever is, when we talk about typhoid fever, I think typhoid is quite common, just like malaria. A lot of people have heard about it. So typhoid fever, we're looking at a type of fever that's caused by Salmonella typhi. That's what we call the bacteria. It's a bacterial infection. So that's the name we give to it. That's the species that causes it, Salmonella typhi. So in this case, you have a high-grade fever. That is why it's called typhoid fever, because the main characteristic here is a fever. So I think this is what causes it. And a lot of people also know that typhoid is fecal-oral. We know that when we talk about typhoid, we are saying that your food has been contaminated or your water that you drink has been contaminated by fecal matter. So that is typhoid in simple terms. Yeah.
Okay. So what are the causes of typhoid fever?
Oh, I think we've looked at the bacteria that causes it. And we are saying that this bacteria, as human, is able to enter your body through food or water. So when the water you drink or the food you eat is contaminated by this bacteria and the bacteria gets into your system, then you have typhoid. And then typhoid usually behaves like malaria. So on a normal day, the way you feel, and then typhoid in Chi, we have something we call that's what people begin to say. They come to the hospital, you ask them, what's wrong with you? Oh, doctor, baby, I should have but as a main so but they can't really specify what is wrong with them aside the fever. And usually the fever doesn't even come within the first few days. That's not the first thing you see. You just feel that something is wrong somewhere, but you can't pinpoint exactly what it is. Yeah.
Wow. Okay. Is it common?
Oh, typhoid is very common, but I think we have specific, like when we take Ghana, we have specific areas because we are looking at contaminated food and water. So that means that hygiene plays a very great role.
Contaminated food? What do we mean by that?
So we said the cause is bacteria. So once the bacteria is found in the food or water, then it means it's contaminated. It's no more clean. It's no more hygienic. I think we've looked at sanitation and hygiene, if I'm right.
Yeah.
So, yes, so it's good we've looked at that first, because in typhoid, sanitation and hygiene play a major role. So before your food gets contaminated, that means that there's dirt somewhere. How did fecal matter get into your water or your food? So we are looking at buying food from street vendors, and then where you also fetch water. Where do you get your drinking water? Where do you buy your food? Fresh vegetables and all of that. People who sell food, you don't know the water they use in making their foods, their ingredients, have they been cleaned properly and all of that. So that is what really brings it to us. Yeah.
Okay. Yeah. Madam Lillian, how is typhoid fever transmitted? How is it transmitted?
Okay, so fever can be transmitted in several ways, but one of the easiest way it can be transmitted is through fecal oral route, as she already said. Let's say, for example, you went to use the toilet and after using the toilet, you didn't wash your hand, and then you went to use the same hand to eat, like, for example, eating of macaroni and the rest.
All right.
So this bacteria, once you use the toilet without washing your hands, the bacteria is already in your hand, and go and eat the food gets into your mouth, you take in the bacteria. And another way is through handshake. Somebody who is contaminated, somebody went to use toilet and the person didn't wash their hand, and you went to shake their hand. That is why it is always encouraged to wash your hand. Hand washing is a practice that is always encouraged. And another way is through buying or taking of food. You know, normally the farmers, they normally use the animal waste as fertilizers. They use this waste as fertilizers, and then they plant their food crops like beans and the rest. And you go and take this food like carrots, and you don't wash it well before eating it. You take in the bacteria, you take the bacteria into your system. Yes, and then contaminated food, drinking of contaminated water and the rest. That's how it's transmitted.
Wow. Well, okay, Madam Marian, what are the common symptoms of typhoid, and how can someone realize I have typhoid fever?
Okay, so like I said before, usually when typhoid starts, you just feel uneasy, but you can't really tell what's wrong with you. And then the symptoms begin to show after like 5 days of infection. So between 5 to 21 days, that's when you begin to show some signs and symptoms. So we are looking at a fever first of all. So you know that your body temperature is above the expected limit. You have loss of appetite. You're not be able to eat properly as you always do. And we're also looking at diarrhea or constipation. Usually it's one of them. It's either you are extremely constipated or you have diarrhea, continuous running, you know, watery stools. Yeah. And then, like I said, loss of appetite as well. So, I mean, if you are having loss of appetite and then you are having diarrhea, you begin to ask yourself, I'm not eating much, so where is this coming from? Or constipation, like I said. And then the major thing, fever, yes. And then headache sometimes as well. Yeah.
All right. Okay. Madam Lillian, who is most at risk of getting this typhoid fever that we are talking about?
Okay, so before we come to that, let's talk a bit about the causes and how to recognize it, how to know that you have
typhoid
fever. Let's say you have abdominal pain, your stomach is paining, your abdomen is paining you, and then you're having diarrhea, but the diarrhea look like pee. Like the feces look like urine. Okay. You are running, but the feces look like urine. And then we also have symptoms like the typhoid tongue. Your tongue will be kind of whitish or gray or yellow with red edges. Okay. So when you notice things like that, those are some of the ways to identify that you have typhoid. And then you also have the rose-colored rashes. Rose-colored rashes is like just, they are rashes that are found around. They are mostly found around the navel, and they are reddish in color. So when we are seeing this kind of symptoms, you are seeing it out on you, the best way is to visit the nearby clinic for early detection and treatment. So those mostly at risk are people living in poor sanitation area, people who eat raw food, like you don't cook the food well, like you are cooking the food, is not well cooked and you eat it. You know the food is already contaminated. So when the more you cook it, the more the heat kills the germs. So if you don't cook this food well, you get the food get contaminated and you take in the bacteria, which is the Salmonella typhi, into your system. And also people living in crowded environment, people living in crowded household, like the place, and a lot of people are staying there. That's the easiest way to get it, because when someone is contaminated and when someone is infected, they can easily infect you with the bacteria. Wow. Yes, please.
If I may ask, what of, you were saying that buying food from unhygienic area, or let's say food vendor, does it mean that eating too much oil food, does it also cause that?
No.
Doesn't cause.
Too much oily food doesn't cause that. Oily food has its own side effects, but that is not what that causes diarrhea. So the food vendors like this, when you go and buy food that is not hygienic, that's when you get let's say the person you're buying the food from, their surroundings it's not clean. That's when you get this infection.
Okay.
So that's why it is mostly encouraged. As much as buying on street food is not encouraged, but when there is a need to buy the food, you should always check the environment.
Okay.
Yes.
Madam, how can people protect themselves from this typhoid, especially in areas of poor sanitation?
I think Lillian has really said a lot. Yes, so we are talking about sanitation again, since we are talking about the environment where you buy the food. So before you go out there to buy food, you check the environment of this vendor you are buying from. People who love wache always says that if the wache is not by the gutter, it's not the best.
Yes.
There's a guy, he also like kenkepa.
But you see, this is what we are looking at. We are saying typhoid is fecal oral. You are seeing a gutter right in front of the vendor, but that is what you also want to eat. So then you are not helping yourself. So again, we talk about sanitation, we are talking about your environment, and even you, the individual, try to clean your environment, practice personal hygiene, like Lillian said, wash your hands after using the washroom so that you don't get contaminated with this bacteria in the first place. Overcrowding as well, try and space out too. We have areas that are really overcrowded, or even families that live in one room and then so many people are living together. All these things can be prevented. Yeah.
Does it mean that typhoid fever is not that dangerous, and so it's not killing most people? That is why people are carelessness about buying food everywhere.
I think typhoid, it kills, it's dangerous, but Ghanaians are quite nonchalant, I must say. We take it so lightly, but it's not. When typhoid gets serious, we have let me say complications. When you are supposed to treat it, you've detected that you have typhoid, the doctor says it has been diagnosed, and then you don't go ahead to treat it completely. There are complications. When it gets to the highest, we have something we call intestinal perforation. Imagine your intestines getting perforated, or getting in a layman's term, we'll say maybe a hole or something, and then bursting out. It's not that easy. That means sorry, we have to go to theater and then get cleared of that. No, we don't want to get that far when we could just treat with antibiotics.
Okay.
And even we say prevention is better than cure. So why don't you just clean your environment? If there's a need to buy food outside, like Lillian said, check the environment you're buying from.
Okay.
Drink clean water, possibly boil it, and then you know that it's hygiene, because heat will kill the germs, and then you can consume it.
Does it mean that we are thinking about our stomach, and we are not even thinking about our health? Because you go to one joint and you see that the environment is not okay, but most people are buying food over there. People are enjoying the meal. People are seeing this woman, they share. And does it mean that we always focus or concentrate on only our stomach and not only on, in quote, our health?
So sometimes it's not just only the stomach, it's finances. So people, some people who normally go to this place to buy food is due to their financial status. So some of them cannot afford these big restaurants, expensive restaurants, so they end up buying food at this place. That's why today we are pleading with food vendors out there to always make sure they keep their environment clean. They cook their food well, so that those who cannot afford the expensive one and come to them, they will help protect these people. Yes.
Wow. Okay, how is typhoid diagnosed? How is it done? And what are the treatment options for typhoid?
Typhoid is diagnosed in the clinical settings. It can be through blood culture. That is when they will just take your sample, your blood sample, and send it to the lab to check. So when you have this infection, the bacteria Salmonella typhi will be found in your blood. Yeah, and then another way is the stool culture. But the stool culture is mostly not recommended. That's taking your stool. It's mostly not recommended because at times when you have this condition and you do the stool culture, it will come out as negative, although you have the condition. So the most sensitive one is the bone marrow culture. That is when they will take sample of your from your bone marrow and test it. And how is it treated? And because of when you have diarrhea and when you have typhoid, one of the easiest symptoms is the diarrhea. So you become dehydrated. So the easiest treatment is to rehydrate the person. That is putting the person on IV fluids and also encouraging the person to take in enough fluids, like water. And also you can put a patient on antibiotics like Cipro. That's the way of treatment.
Okay.
Yes, please.
Madam Marian, if typhoid is left untreated, can it cause a long-term complication?
Okay, I think I mentioned one complication earlier. So Lillian has said a lot. So if it's left untreated, just like any other illness, if left untreated, definitely there's complication, not just typhoid, even malaria. Every other disease, when left untreated, there are so many complications. So we advise that once you, not just typhoid, but immediately you feel ill, just go to the hospital. Once you are tested, the doctor comes out to say, oh, this is typhoid. Get the recommended treatment and then be free. Don't ignore it and probably say because your symptoms are not so severe, you rather go and sit at home. No, you have to treat it to avoid such complications.
Okay. Madam Lillian,
Yes,
how does poor sanitation contribute to the spread of typhoid?
okay, so poor sanitation really contributes to it because in a situation where your water bodies, the environment is not being kept well, people normally defecating in water bodies. These water bodies are the same. They are the same water that is used for domestic use, drinking, cooking, and the rest. So when you contaminate this water, defecates inside, people go and take this same water to drink and cook. They take, as they are drinking the water or cooking with it, they are taking in the bacteria, which will spread and affect their system. Yes, and keeping your environment clean. Food vendors not cooking food well, not keeping their surroundings clean. They get their food contaminated, and when people take in this food, they take in the bacteria, which affects them.
Wow. Okay, Madam Marian, what role do government and public organizations should play in controlling this typhoid fever we are talking about?
Okay, I think to add a little to what Lillian said, there was a case some time ago, I think maybe a year or two ago, around OEB. I'm sure a lot of us heard it, but that was food poisoning.
Yeah.
But that also tells us, you see, people who bought from that vendor that day, a lot of people got ill. Yeah. So I think that alone should also serve as a deterrent to other food vendors to keep their environments neat. Because definitely if that vendor is still in the business, I don't think she will have customers anymore. And I think government is already trying their best because we see Zoom Lion on the street every day trying to clean up gutters and all that. But it all boils down to we, the individuals. Before you go out to clean your environment, have you cleaned your home? Your home is equally important because we said this is fecal-oral. Fecal matter is also in your home. It's not only outside. So you have to clean your home before you come out to clean. So I think this typhoid is really about sanitation and hygiene. And I'm happy we did sanitation and hygiene before coming to typhoid so that people understand what we are saying better. Okay. So all we are saying is keeping your environment neat. The government is also doing its best because I know these food vendors, we have government agencies that go around to check from time to time their hygiene condition and all that. Even
but it is not effective.
Yeah, that's rather unfortunate. But why are we waiting for government to do that before we do what is right? We are the same people who are going to get ill. We are the same people getting infected. You don't wait for the government to be on your neck before you know that as a vendor, or as an individual, you need to sweep your environment and then keep the place clean. No. As someone who sells wachi, you are right in front of the gutter, and the gutter is full of so much dirt. And you are still right there. You're not cleaning the environment, you're not doing anything. And I think as individuals too, if we stop purchasing from places like that, people will learn. So it's all about hygiene. The government is trying, but as individuals, we should also play our role.
Okay.
Yeah.
Now, what should we do to prevent typhoid fever, the spread of typhoid fever? What should we do?
So we should keep our environment clean. And then food vendors should also be screened medically.
Okay.
And then there should also be enforcement of law after cleaning this environment. So you earlier stated that the government is not, you are not seeing the effectiveness of the government. That is, the government can come in when the community, when the government see the efforts of the community. So communities should engage in communal labor. Let's say they can find a day of every month where they clean their environment, clearing of choke gutters. And after doing this, they should educate the community on the effects of poor hygiene and the effects of typhoid. They should also bring out laws to laws breakers, so that when anybody go against this law, they will be punished. Yes, those are the ways of we should keep our environment clean, our surroundings. We should make sure they are always kept clean. The community should protect the people by enforcing laws to protect the sanitation of the community.
How do we check that as a food vendor, the plates, the spoon, whatever I'm using to sell are hygienic? How do we check that? Because indeed, after enforcing law, after doing whatever, after checking that the environment is okay, the kind of things they use to sell, who checks who?
Well, I think that's why we are encouraging them to. So, as a vendor who sells food, let's say you have a small eatery or something where people can sit and then have a plate or two.
Yeah.
Once they are done eating and then...
Do you know that some of them, some of them are selling wachi, and they don't have this kind of plastic spoons.
Yes.
So they have the metal one.
Yes.
So after eating, they wash the spoon. Another person too comes that person to use the same spoon.
Yes.
They plate to the same thing.
So for small places, just street vendors, we advise disposable spoons. You use it, you throw it away. Because usually when you go to these restaurants, they sterilize their things. Their spoons, they try to boil it. They have ways of getting it sterile, but our vendors, we don't have time to do that. So the best thing is to just use a disposable one. And then, but for the plates, at least we know that washing with good soap and water is enough to get rid of these germs. And I don't think that should be too difficult to handle.
Okay. Madam, your last word, advice to the general public, advice to food vendors, advice to individual. What should we do so that this kind of typhoid fever, we can eradicate it? If not eradicating it, we can reduce it drastically in a way to help individuals stay healthy. What should we do? Your advice?
So I am pleading with food vendors to make sure they keep their sanitation level well, and they should also the community members should keep their environment clean.
Yeah.
And even though we try to prevent this condition, but when there is a situation where you are experiencing this condition, please try and visit the nearby facility.
Okay.
And we already stated the symptoms.
So we should not go to the pharmacy and buy anything?
No. Typhoid is only diagnosed in the clinical settings. That is when they take your sample to test it in the lab.
Okay.
So please, when you experience
because people feel that body temperature, they go to pharmacy to buy 1 or 2 medicine and they are okay.
Okay, so you see, there are some headaches that when you have and you take medication, it will go. But for the typhoid, once your head will keep aching you and your body temperature will keep getting hot.
Okay.
Even in a situation where when you take antipyretics like the paracetamol, still your skin will not, your body temperature will not come down. It will keep getting hotter and hotter. So in this situation, please visit the nearby health center or clinic.
Okay. Any greetings to your friends, your colleagues out there watching you?
So I'm greeting my grandparents.
Where are they?
They are in Sawam. My
Okay.
grandpa is a district pastor,
All right.
Pastor Bonnie.
Okay. That's that. Okay, madam, what should we do, your advice, your last word to everyone here?
Lillian has said it all. Our street vendors should really try, because usually Ghanaians, we like to purchase food outside.
Yeah, that one.
Wachi.
Yes,
these are people, they should really
always
try
with
for us.
black polythene. Always black polythene. A soldier phone, always with black polythene. Okay,
So
madam,
these are
continue.
vendors, they should try for us, because Ghanaians,
Yeah.
we like this, our wachi and other things. So they should really try for us. They should try and keep their environments clean. They themselves, they should practice personal hygiene. Because once you have it, you are giving it to others through food. So, and we, the individuals ourselves, too, we should also try. So it's all about sanitation and hygiene. We should just try our best to keep the environment clean. Yeah.
But I agree with Madam Lillian, because finance is also a problem.
Yes, that's
Now
very
these
true.
restaurants, they are very, very expensive.
expensive.
One bowl of banku and fufu is about 40 or 50 Ghana cedi.
Yes, not
I'm
everyone
not having
can
that money,
afford
so
that. Yes.
I'll go to a wayside
There's
vendor and
nothing
then
wrong with that. But that person that has probably put just a table and chair outside and is sitting, at least clean up that table, clean up the plates and pots that you are using to cook.
Okay.
Just, we are not saying that get an expensive setting before you can sell. The little place you are doing, you know, you walk into a place, someone is selling maybe just watch it. You look at the place and like, this one is very neat.
yeah.
But she's not in a restaurant. So let's all try to do that.
Okay.
Yeah.
All right. Any greetings to anyone?
Oh, I think all our greetings will go to Ensign Global College.
Okay.
Yes.
Wow. Okay. So viewers, we'll drop the curtains. My name is Sylvester. It's a very big thanks to Madam Lillian Adams. Lillian Adams. Okay. And then Madam Mariam Darko. The two of them, they are welcome. And a very big thanks to the team, Yima, Moses, Percy, and Silver and Co. A very big thanks to you. Mario, the production manager, a very big thanks to you. My name is Sylvester. At the same time, next week, Monday, we'll meet here on Marigo TV. Thanks for watching.